So let's start by saying hello and welcome to everyone for coming here today. My name is Elizabeth Devaney and I'm the CEO of Consumers Health Forum of Australia. I'm delighted to be hosting a video today with our Australian Digital Health Agency colleagues joining us as well. So there were two parts. There's today and then again in a fortnight. Today's a bit of show and tell, and in a fortnight will be a bit of exploring your questions. So just before we get formally started, a few things to do. First of all, I really would encourage you to now go into the chat and say hello. So we'd like you to say hello. Maybe the name that comes up under you is not the name you prefer. Perhaps your name's Catherine, but you prefer Kathy. You can put, hi, it's Kathy. We love to know where you are, whose country you're on. I'm in Wurundjeri country here, but love to know where you are. And also what your pronouns are. Let us know so that if you ask a question or we want to comment on something that you've popped in the chat, perhaps, we'll know how to address you appropriately and respectfully. So I'll just give you a moment. There's about 30 odd of us. So in a moment, there'll be 30 things in the chat. This is always really lively. And sometimes when we do it, we see people we've never heard of before, we haven't seen for a while. Margaret, I think you were on our webinar last week too. So hello again from WA. Last time we had a big WA contingent. I don't know if we do today. Do let me know if you're from WA. It's lovely to hear. Oh, Auntie Maureen's here too. We've got people from the top of the country and the other side of the country. Here I am in Naarm. It's always lovely to see all of that. Gives a sense of connection. Hi, Sue on Yorta Yorta land. Great. I think about a quarter of us are done. The rest are furiously typing. So I'll just let you all do that. Again, if you're just joining now, great to just pop your name, where you're from, what your pronouns are, anything else you want to share. We're really open to sharing whatever you like. And then in a moment, we'll start more formally. A couple of folks just arrived. For those of you just joining now, we're just popping into the chat and saying hello to everyone. You'll see others have done that already. Just their name, their pronouns, where they are, this country they're on. Nice way to just start the meeting. And I'll just give you a few seconds more for those of you that have been writing. No one should feel hurried. Thanks, Calvin. And welcome, Inam as well. Sure. So as we start, I'll just would make a note that we don't allow bots or AI bots in the meetings unless you've already arranged that with us previously because of accessibility reasons. If any bots appear, we will just boot them out of the meeting. So letting you know in advance. Okay, so let's start and begin by also acknowledging that we're on the lands of the traditional owners all over the country, and we can see that Turrbal and Jagera country and Yorta Yorta country. I don't know if we've got anyone from Ghana country. Is anyone from Ghana country here today? Seen people from everywhere. Some people from the lands of the Eora Nation. Fantastic to see you all wherever you are. I mentioned I'm in the land of the Wurundjeri people of the Eastern Kulin Nation, and I'd like to pay my respects to elders, past, present, and emerging. And also really big respects to any First Nations people who are here with us today. See a couple of names. We've definitely got a couple. Others I may not know. Huge respect and welcome to you all. As well as acknowledging country, we also need to acknowledge the lived experience of people who work in the consumer sector. We deeply respect the lived and living experiences of health consumers, carers, families, and communities across Australia. We recognise the right of every person to equitable access to healthcare, regardless of their background or circumstances. We value the lived experience, expertise, and personal commitment of consumer health advocates working to influence change. And we seek to elevate the voices of those who have navigated the complexities of the health system and partner with them to drive meaningful and inclusive change. It's very important to us to recognise many of you here are health consumers. Very important to recognise that. So Zoom, I imagine a lot of people have used Zoom nowadays in kind of 6 years post when COVID first hit and everything became virtual. If you haven't, here's a quick update. Really important, if you're not able to find something or not sure how to do, if you pop in the chat, I'm having trouble with, the team are monitoring it and they will get straight back to you. We also monitor our admin@chf.org chat all the time too, because if the problem is you can't get into the chat, you can't tell us that way. So admin@chf.org.au. If you get stuck, someone will get back to you. Zoom gives us the benefits of lots of interactivity and we really like to use that. And you'll see down the bottom, hopefully you can see there's an option for reactions. So if you click on there, there's a whole lot of different ones you can have. And now what I want you to do is try every single one. Just get your fingers onto the keyboard or onto your phone and you're great. That's it. Try them all. Try every single one. See what you think of it. Haven't seen any rocket ships or parties yet. A few love hearts. Don't think I've seen any balloons. I know someone's got to have a birthday somewhere today. Claps, surprise looks. We're going to be using these during the day. Feel free, if someone's saying something and you like it, to give them a heart or a thumbs up or a clap or a party. If something surprises you, you can use a surprised reaction. Use them however you like, but it's one way you can be interactive in the meeting. So I mentioned about the bots, also just mentioned that the meetings are recorded and then we put them up on our YouTube channel so that you can share them with friends. And that can be helpful too. If you find the session is really helpful, then we really encourage you to share it with somebody else. And for those that don't know about CHF, perhaps it's the first time you've come to something we do, big welcome to you all. Our role is really to collect the views of the community, health consumers, and then translate that into a mechanism or into a message, if you like, that we can pass on to governments, primarily governments, but sometimes other significant organisations, to let them know what it is you want and need. So our role is really to be that amplifier and that conduit. So it's really important for us to hear from you what it is you need. So this webinar is a little different from some we've run in the past because it's two set. So there's today and then in a fortnight. Often we run things that are standalone. And the idea of this one is really to help you feel more confident in using My Health Record. That's the plan. So sometimes learning something new can feel a little overwhelming. Even something you've used before that changes. Perhaps you've used My Health Record on the web portal, but never the app. Perhaps you've seen someone's app, but never seen the web portal. Perhaps you're not even really sure what's in there. Could be anything. So we're hoping today you'll get really simple, practical and easy to digest advice on how to use My Health Record. The webinars are short, but we're hoping there'll be enough time in the webinar for you to get what you need. So this is what we'll be doing today. First of all, Kun from the Australian Digital Health Agency will be taking you through a clear walkthrough of My Health Record, what it is, how it works, what the key features are. And then you'll hear from Saba, a My Health Record consumer. So Saba uses My Health Record all the time. And she'll talk to you about how she's been using it and what's been good about it. So at the end of the session, we hope you'll have a really good understanding of what to expect when you log in and how to use it. So first, over to Kun to tell us all about My Health Record. Thanks, Kun.
Thank you, Elizabeth. I'll get on screen and I'll share my screen here. Okay. Okay, let's go. Can you hear me, everyone? Thumbs up if you can hear me. It's good to check. Yes, excellent. Hello, everyone. Wow, that's great. So many thumbs. Thanks, guys. So my name is Koen van Veneet here. I'm a digital educator with the agency, or the Australian Digital Health Agency, which is the full name. Um, Before we start today, if there's anyone here from the media, could you please make yourself known? Just put your hand up. Any sign? No? Good. We'll move on. I'd like to do, after this very impressive acknowledgement of country of Elizabeth, thank you very much for doing that. I'll do a quick one on behalf of the agency. So the Australian Digital Health Agency acknowledges the traditional custodians of country throughout Australia and their continuing connection to land, sea, and community. We pay our respects to elders past and present, and I would like to add actually their future as well. And yeah, I think it's really great that we can actually continue the tradition of education as it's been practiced by many Aboriginal cultures in this beautiful country for tens of thousands of years, here today with you on the grounds where you're calling in from. So yeah, just wanted to share that. Um, while we go, and I just want to stipulate this so it's clear to everyone, if you have any questions that come up during this session, please put them in the chat and we will capture them, but we won't answer them right away. We'll take them away, and then in session number 2, we will have a chance to cover some of those questions in the session and get them answered by our panelists. So if you put your questions in the chat, yes, please do. But there might not be much answering happening today. All right. So learning outcomes. What do we expect you to take away from this session? So we hope you understand how My Health Record and the 1-800-Medicare app, which is the new app, a follow-up of the My Health app, which it was in the past. This is now an upgraded version called the 1-800-Medicare app, and how they can support your healthcare. Further, we'd like you to be able to identify the privacy and security aspects of My Health Record and the app. We also like you to understand the role of authorized and nominated representatives in My Health Record and the app. I'd like to watch a quick video with you. I'm gonna try and get the sound right. See if I can get that right. What I'm gonna do is I'm gonna toggle a screen. Please put your thumbs up if you can hear this. Actually, if you can't hear anything, maybe do it then. That's even better. Put your thumbs up if you can't hear anything. I'm playing it now. Can you hear the
Australia's a
audio?
pretty interesting place. 2.5 million square kilometres, about 2.5 million people, just over now. On average, that means one person
Is that good? That's good. Okay, we'll keep going.
per square kilometre. And that means that some people who we care for are a hell of a long way away. And when you've got a big place, often it's hard to ensure that people are connected and that information is well shared. And without doubt, at the moment, the best place that we can have access to is the Australian My Health Record. So information collected in one location becomes information available in another location. And that now doesn't matter whether that's 2,500 kilometres or 2.5 kilometres. And the fact that it's becoming universally available is valuable. The fact that Western Australia now accesses the My Health Record 10,000 times a day.
I think it dropped out there shortly. Is that right? I'll make sure you get the links after to watch this again. In summary, this was Dr. Simon Towler, who explained how great it is for his practice. And it's interesting because you'd be wondering, why do I show this during a consumer webinar? Good question. I think it really gives a good idea of the other side of My Health Record, as I call this. So what it can really do for your healthcare from a healthcare perspective. Now, of course, the big question is, what can it do for you? That's what we're going to talk about now, but I think it's always good to have that bigger, more holistic picture. And as you can see in our great country that is so large, it can be so great to have all this information in one central place accessible. All right, so what is it? It's a summary of your key health information. It is personally controlled. This means you have say as to whether you have a My Health record, what gets uploaded, what stays in your record, who can see your record. Further, it's a part of a national system, which means it travels with you wherever you are, no matter which registered healthcare provider you're seeing. And your My Health record is always accessible. Further, it's important to know that you can actually, it is protected via legislation, primarily the My Health Record Act 2012, and it's secured through multiple layers of IT security. And we have actually a cybersecurity center which monitors, maintains, and improves the system 24/7. So what's in it? Well, a lot. If you've never accessed this, it might be slightly overwhelming. In summary, this is what you'll see here. This is what's in it, and it's actually split up in three groups. The top three here. So roughly, there's of course viewing and adding that you can do yourself. These are records that you can view. These you can add yourself. But there's actually three kind of categories in there. Under the viewing ones, we have the first top three here. They're uploaded documents from healthcare providers. Could be your GP, could be doctors in the hospital you've been admitted to. It could also be your pathology and diagnostic imaging clinic that you go to, for example, for a blood test. But then the next section is uploads done from other systems. So other digital systems that have their health data from you, that's where your immunization information, your medication information, and your Medicare information in My Health Record come from. And then last but not least, and I think the most important for us, is the personally entered information. Things like a personal health summary, which is where you can add information yourself about allergies you have, adverse reactions you may have experienced, or medicines that you're taking. There's also the personal health notes section. This is not visible to healthcare providers, so this is really your little area or your representative's area where you can add notes about your health, just for you to remember. Further, there's also a possibility to upload advanced care planning and contact detail and emergency contact details. How do you get in? Good question. Well, if you haven't been in yet, make sure you log into your MyGov. That's the first step. Once you're in there, you can link your My Health record in MyGov. It's pretty similar to what you can do with, I think, the ATO, but please have a look in there and make sure it's very easy. When you're on the homepage, you can actually link services. Further, there is verify your identity over here, which is where you are asked for a range of documents to identify yourself, which may include things like your Medicare card or DVA card. And once that's been done, you can access your My Health record. Let me actually share this with you in the chat. It's good to have that one always ready. So when you're in, this is what it looks like. It may look like, depending on how you enter your My Health record. This is when you enter it via the browser on your desktop computer or your laptop. It will look quite different on the new 1-800 the 1-800 Medicare app, which we'll look at later in this presentation. But for now, let's look at this. This is what the first screen would look like on your laptop or desktop computer. Your name would be displayed here. That would, for most of us, probably not be Sang Steel, since that's a test participant. And your age will be displayed here too. You select that one, like that, and then you get onto the record homepage. If it's your first time logging in, there's a little disclaimer here that there might not be that much data in it yet, which will give you a couple of tips about how to get that in there, and alerts, reminders, and notifications. Now, first of all, if you go in for the first time, I would recommend going actually straight to privacy and access, which is over here. There's a lot of information here, and this is the place where you really make sure that the data that is in there is only seen by the people you want it to be seen by. My representatives are the first option here. So here you can actually assign a nominated representative. That's someone who can help you with your managing your record. If you need some help with that, a nominated representative is a great choice. And you can set 3 levels of access for these nominated representatives. So you can give them access to view only general documents. You can give them, you can access to view only general documents. Then you can give them access to view or look at only restricted documents. And we'll talk later a bit more about that, what that is. And you can give them the full access as much as you would have it, which is view and edit. There's also another type of representative which you can set up here, which is the authorized representative. The formal process works via a form, which I'll put in the text as well, in the chat as well. There we go. Then there's my healthcare organizations. These are your what I call trusted healthcare organizations. So later on, we'll see that you can actually put codes on certain documents and even on your whole My Health record to control who is able to get in. The trusted healthcare organizations, you can give them the code to access your documents or your whole record. And that's what you do here. This is where you select your healthcare organizations. Now, before you go in there, you need to go here. This is your document access and where you manage it. This is where you request in case of a document you want to actually protect, you can set a limited document access code in here. If you want your whole My Health record to be code protected, a record access code can be set up here. And that once that code's been given once to a healthcare provider, they always have access until you revoke it again. Also, that can be done in here. Further, My Health record access history. So this is a log of who has accessed your record over the last months, and it actually shows what they have done. So you can really keep track of what's been happening in your record. I'd like to give a little call to action for everyone. So after this session, if you haven't done it yet, log in and look at your privacy settings and tailor it to suit you. Some people don't mind. They don't have these settings set up at all. And then by default, for any healthcare provider who is involved in your care, they can access all the documents in your record. But if you don't like it, I hope you have a bit more understanding of how to set up some controls there. So let's have a look at some clinical records. So this is, if you hit the Documents tab up here, this is your main navigation area. You would end up on the record homepage. It also has alerts and reminders, as you can see. If you go to clinical records here, you click that, you end up over here. And this is where all the good stuff is. So I'm not going to go through them all right now, but if you can, look through your information and see what's there. Again, set some privacy and access controls if you're concerned. And if there's any information missing in here, because when you click these, you'll get to actually see the documents in there, discuss it with the provider. So your GP might have not uploaded the shared health summary, which they should have done, or your pharmacy has not upgraded their shared medicines list, or your path and DI reports are not there, which would be pathology reports or diagnostic imaging reports over here. You can contact these organizations and actually request them to do it. All right. What is the 1-800-Medicare app? So the 1-800-Medicare app is a secure and convenient way to view key health information that you, your healthcare providers, or representatives have uploaded to My Health record. It also gives you access to electronic prescriptions, which are like a paper version of your, an electronic version of your old paper prescriptions in your My Health record, and in this case, in the app on your phone. It also has other great features. For example, you can book a health service over here. You can also use the symptom checker to find out what that symptom might be that you have and what's the underlying cause. Further, you have access to Medicare information as well as enrollment and claiming services, and you can access and share all this information from the palm of your hands. And as you can see, you also have access to your scans and test results. And I think it's for example, in that context, really useful. Like if you go to a doctor who does not have access to your My Health record, but wants to see your latest blood test results, you go in here and you can actually share those results with your provider. Finally, in the app, it provides you with access to the 1-800 Medicare service, which you access via a little phone over here, the phone icon. It's a free 24/7 hour service where you can speak to a registered nurse about any health concern. That nurse will ask you about symptoms, guide you to the right care, tell you what to do next. If you'd like to know more about it, I would definitely have a look and start using it because it's quite a powerful thing. And if you want to find it via the QR code, you can do that obviously as well. Any benefits? Yes, there are so many. I think I already gave a couple, but I go through them quickly. So this is the place where you can find all that key health information securely. Electronic prescriptions I already covered. That's like a new version of your old paper prescription, but then in electronic format, digital, actually stored on your phone. And as you can see up here is ASL settings, which is another interesting topic. If you have a lot of different prescriptions that are repeated over time because you have, for example, chronic disease, setting up an active script list or an ASL with your pharmacy is really recommendable. It will make things a lot easier because all those scripts are then in one centralized space. All right, view and update privacy and access settings. I talked you through that already. So that's all about setting up those representatives if you'd like them, making sure that you give access to your trusted healthcare organizations, and also setting up any document controls that you've been wanting to do. This is very similar to that screen I showed you earlier. I think I'm going to answer that question in a minute that I see in the chat. So multiple records are visible in there if authorized. So if you have children or you're actually a representative of someone, whether it's nominated or authorized, you can see them in here. Further, it has an additional layer of security on there. So you can set up a security code if you'd like and use that to log in. Further, you can add, edit, and view your emergency contacts. This is where you really add information that is essential for an emergency. If you end up in an emergency, doctors can get in here and actually get the right information, who to contact from here for you. That brings me to the end of this hopefully not too long presentation. Any learning modules, if you'd like to practice a bit with what I've just talked about and learn more about it, please access the learning modules page with a whole library of e-learning modules online. I'll post that link as well. And I think that brings us to the last. I'll skip this for today. I think we're good to move on. Thank you, everyone. If you want more contact, our contact details are here. And I'll hand over back to Elizabeth.
Thanks so much, Kun, for all that really great information. Really conscious of time, and if people can hang around for an extra couple of minutes, that would be great, because I'd really love you to hear from Saba now for a few minutes, who could talk to you about how she's been using My Health Record. Thanks, Saba.
Thanks, Elizabeth. So for me, the My Health Record is such a powerful tool because you can access all your health history, the medical appointments, the pathology testings, the diagnostic and undiagnostic test results, vaccinations. And I can quote a couple of examples. So one is for my toddler. So one night, he just got his hand in the door. I had to take him to the emergency. I was in a very panic mode. You can understand, a baby of like 2.5 years old. And he got his x-ray done and everything is done. And I came back home around like 12 midnight. And then I forgot to take the discharge summary. So my husband was asking, and the next day I had a follow-up appointment. And I was in a panic mode that I thought I should give a call to the hospital. And then I realized that we have got a My Health Record app as well. So I just checked online, and then I realized that discharge summary was really there. So that was such a huge relief for me. It really prevented me in going back to the hospital, getting the discharge summary early morning with a follow-up appointment. So one incident is that. The second one was, so I was pregnant, I was traveling, and then all of a sudden my doctor called me because I live in a regional area. So my doctor called me that she is going on a leave. So she wanted to look for me to have a very quick telehealth appointment. And I didn't have any paper with me. So I was just unsure, how to respond, because I was just unsure, which test was done, my ultrasound report and everything. And then I realized that everything is on my health record. So I just checked everything, and all the, all my pathology results were there. So I just told my doctor, oh, that's okay. We can have a tele appointment now. So that was really good, because then again, my continuity of care was not broken. Again, with the new GP, I didn't have to repeat my, the history all over again. So that was really good for me. So I got a teenage daughter as well. So she has got her own My Health record. But it's so good that if you go on the agency's website, they have got a module. So you can always share the module with your teenage and the young people, because sometimes, the young people don't want to listen to the parents, but they can always do everything online. So, she really got the essence, how the app works, how she can access everything online. So the app, so she completed the module and she was able to access her records, the pathology results, the appointment. Also, the app is really helpful because it keeps on sending me the reminders that my family is due for some vaccination or any results or anything, in case if we need to engage with a specialist. So the reminders and the alerts really help us. Also, if you're traveling overseas, you can always look for your COVID vaccinations, because sometimes, it gets tricky when the border protection, really asks for the vaccination certificates. So you can always, it's, for me, the app and the website, definitely this My Health record is a one-stop shop for everything. Also, now I'm in that, in that phase that there is a chance that I might be going in that perimenopause, and I really wanted to know more about the resources. So I realized that on My Health record, you have got those informations tab as well, where you can always look for the medical conditions or anything with the allergies, and you can always know more. So definitely you can read everything which is there under the resources sections, because definitely it's a trusted resource from the agencies and from the government, which is again endorsed by all the health professional bodies. So I would highly recommend you to download the app, look for everything on the website, make sure that, your kids are having the app on their phone as well, and they, you can always look for the privacy settings, and you can always make sure that, everything is very secured and confidential. So yeah, that's my personal experience.
Thank you, Saba. That was a mountain of different ways that you've used it, and it's been really beneficial for you and your family. So thank you. And how about sending Saba some love? Get your reactions happening. It'd be great to say thank you to Kun and Saba for their conversations with us today. Fantastic. Thanks, everyone. So as we're just over time, I'll quickly mention to you, and there are some really great questions in the chat already. Now's your time to pop them in. Any more questions you've got, because the next session in a fortnight, we'll be answering these questions. So put them in the chat, but also you can email them to us at communications@ctf.org.au. We need them by the end of the week. So if you go away, get on My Health record, or go to the app 1800 Medicare, try to do something and it's not intuitive or you don't like it, send us your question, your comment, your thought. We'll send this all to the team at the Digital Health Agency, and then come to the next one. When you come, we'll be answering your question. So it's like choose your own adventure. Whatever it is you're asking for, that's what you'll get. And we also encourage you now, we'll download this and share the webinar to you, to give it to your friends to look at as well. They can go on the Digital Health website. There are fact sheets there. We have fact sheets too. And then come along to the next one to hear the questions that you've asked being answered. So I'd like to thank our speakers, Saba and Kun, and also thank the great CTF team who did a whole lot of work to get this going. Emma and Ben and Tom and Nami, there's so many folks that get these things happening. And I really look forward to seeing you again on the 16th I might be in my green because it's the day before St. Patrick's Day. I might be doing a bit of rehearsal. Feel free to be in your green too. And meanwhile, send in those questions because that's what we'll use to structure the next session. Thanks very much, everyone. Have a great day.